order. Social distancing is the only way we are going to stop the spread of COVID-19 in Hawaii. I would also like to recognize Hawaii's physicians, nurses, medical personnel, and first responders for being on the front line of this pandemic. On behalf of all the residents of Hawaii, we are extremely grateful for your hard work, dedication, and commitment. Thank you. In a matter of just weeks, we have seen how the COVID-19 pandemic has turned our community upside down and is forever altering the way we once lived. While we are all working to flatten the curve, we are also dealing with the impact it is having on our community. Individuals, families, businesses all across Hawaii are feeling the direct impact each and every day. Small businesses in Hawaii are the backbone of our community, and they are struggling. I am hopeful that the federal stimulus package will be able to quickly provide them with some relief. Included in the CARES Act is the Paycheck Protection Program that will provide forgivable loans for small businesses to pay their employees during the COVID-19 crisis. Applications will start being accepted on Friday, April 3rd for small businesses and sole proprietorships. Independent contractors and self-employed individuals can apply starting April 10th. With me today is Jane Sawyer from the U.S. Small Business Administration, who will provide more details on the Paycheck Protection Program. If you are a small business, contact your bank or any SBA-approved lender today for more information. I also want to encourage all small businesses who are dealing with financial losses from the impacts of COVID-19 to apply for a low-interest working capital loan directly through the SBA's Economic Injury Disaster Loan Program. Visit sba.gov for more information and an application. If you know a small business, maybe a mom and pop store around the corner or a restaurant in your neighborhood who is struggling, I urge you to reach out to them. Print out a loan information for them, urge them to contact their lender, and just see how they can help them through these challenging times. Today, the first day of April, is when our rent and mortgage payments are due for many of us. And for those without a job, it can be terrifying. Stephen Levins, Executive Director of the Office of Consumer Protection, is here by phone and will provide information on what you need to know about Hawaii's Landlord-Tenant Code. Today is also the first day of my mandatory 14-day self-quarantine for inter-island travelers. This is an additional extreme social distancing measure that needs to be implemented to further stop the spread of COVID-19 across our island chain. Tim Sakahara from the Department of Transportation is here with an update on how it is being implemented at our airports and what residents need to know if they are planning to travel between islands. Dr. Bruce Anderson, Director of the Department of Health, is also here with his daily update on the latest cases and testing. I also want to remind everyone that if you have questions about social services or need assistance of any kind, you should be calling 211. You should save 911 for emergencies only. And finally, I'm announcing today that the state of Hawaii received the major disaster declaration from the President. This will make Hawaii eligible for federal funds for a public assistance program and other programs. The Hawaii Emergency Management Agency is already moving forward on the implementation and should have additional information available in the coming days. You know, I have been hearing so many stories about our neighbors and local businesses who have pitched in to help with donation drives, food deliveries, sewing of masks for our healthcare workers, and sharing what they have with others in need. These simple acts of generosity and kindness show how wonderful our community can be. And working together and helping one another is the only way we are going to get through this. And we will get through this, stronger and united. Take care of yourself and take care of each other. Thank you.
Thank you, Governor. Our next speaker is Jane Sawyer, District Director of the U.S. Small Business Administration. Jane.
Aloha, good afternoon. Thank you, Governor, for the remarks. I think you gave an excellent summary of this exciting program that is designed to help our small businesses sustain themselves through this pandemic and also to help get workers back on the job and on the payroll. The CARES Act established a new $349 billion Paycheck Protection Program to provide much-needed relief to millions of small businesses so they can sustain themselves and bring back their workers. We'll be starting this program. It will be launched this Friday, April 3rd, but information is available through your lending institutions, your banks, and the credit unions who currently work with the Small Business Administration by giving them a call today. Sample applications, so you can collect the information needed to apply, is also available. Now, this will provide critical capital to businesses without collateral requirements, personal guarantees, or SBA fees, and all with 100% guarantee from the SBA. All loan payments will also be deferred for 6 months. Then, SBA will forgive the portion of the loan proceeds that are used to cover the first 8 weeks of payroll costs, rent, utilities, and mortgage interest, along with some other overhead costs. You can find more information if you do go to sba.gov and look at the coronavirus page. That will give you lots more information on all the programs that may be available, including the Economic Injury Disaster Loan and also other debt relief that is offered from SBA. Now, a lot of people are interested in the loan terms and the eligibility. Just very, very briefly, that most small businesses, sole proprietors, independent contractors, professionals are eligible to apply for this loan. Small businesses with 500 or fewer employees can also apply, so that's a pretty good-sized business for here in Hawaii. We've waived the affiliation requirements and credit elsewhere requirements. Again, the best place to go for information on your eligibility and application information on this loan is to talk with your lender. The loan forgiveness is available to you if proceeds are used for payroll costs and other designated business operating expenses in the 8 weeks following your loan origination. That request would go directly to your lender as well. The loans under this program have the following features, the same from bank to bank: interest rate of 0.5%, a maturity of 2 years, first payment again is deferred for 6 months, 100% guarantee by SBA, no collateral requirements, no personal guarantees, and no borrower or lender fees payable to SBA. Again, you can find more information and sample loan applications if you go to sba.gov. And thank you very much. And we can all get through this together. Thank you.
Thank you, Ms. Sawyer. Our next speaker is Stephen Levins, Executive Director, Office of Consumer Protection. He joins us by phone now. Can you hear us?
Yes, I can. Thank you very much. Can you hear me?
Yes, we can. Go ahead.
Great. Well, it's no secret that the relationship between landlords and tenants has changed dramatically over the past month. The governor has issued several proclamations. The judiciary has issued various orders, all of which impact the relationship between landlords and tenants in Hawaii. So what we've done is we've created a frequently asked questions, FAQ, designed to help both landlords and tenants understand how the proclamations and the judiciary's orders impact the relationship between landlords and tenants. What the judiciary did, essentially by ordering that all matters relating to summary possession or the eviction process be suspended until April 30th, functionally means that no one's going to be evicted until, or at least until that period of time. The governor's proclamation has invoked various provisions under the Emergency Act that's in place, particularly with respect to the rights of tenants to remain in their premises if there is no material breach of the lease. So, as it stands right now, if you're current, the landlord cannot put you out as long as you are not in violation of any material breach. The federal government, under the CARES Act, has also done something that dramatically impacts the relationship between landlords and their tenants. Basically, if the landlord has a mortgage that is subject to federal jurisdiction, there's a moratorium on all evictions until the end of July 2020. And what this means is that there's a large percentage of mortgages in Hawaii, as well as the rest of the country, that fit this criteria. So if a tenant is having difficulty paying their rent, what they need to do is have a conversation with the landlord. The worst thing to do is to just bury their head in the sand and ignore the problem. Under the circumstances, many landlords will be willing to work with you and try to reach alternative arrangements. Ignoring the situation is not going to be a good way of going about it. So it's a very stressful time, obviously, for tenants, especially if you've been laid off and you're unable to pay the rent. What I can say at this point is that no landlord is going to be able to get you out of your unit while the courts have suspended summary possession. If you have any questions regarding the landlord-tenant relationship, I would encourage you to contact the Office of Consumer Protection Landlord-Tenant Information Center at 808-586-2634. That's 808-586-2634, where we have trained investigators who are very familiar with the landlord-tenant code and very familiar with how these proclamations and the new federal law and the judiciary's orders impact the landlord-tenant. I would also like to talk, if I can, about the stimulus checks that everyone's going to be receiving in the next month or so. We are very concerned that scammers are going to be out there trying to take advantage of people with respect to these stimulus checks. The checks are going to be mailed or put in your checking account by the IRS. You don't have to do anything. We've already seen some residents getting emails from websites claiming to be officials, demanding that they provide PayPal, bank account information, or other financial information in order to receive the $1,200 federal stimulus payment. It's a scam. No one should provide any information to anyone who's contacting you via the internet or over the telephone and claiming that you have to provide information in order to get that, for you to get the stimulus check. So I just wanted to alert everyone, don't provide any personal information, don't click on anything online related to this or anything else, because if you do, you may very well set yourself up for being a victim of a scam. Thank you, and I'll be available to address any questions.
Thank you very much, Director Levins. If you were unable to hear that phone number for tenants, please call the Office of Consumer Protection, the Landlord-Tenant Office, 808-586-2634, 808-586-2634. Our next speaker is Tim Sakahara, Public Information Officer, Department of Transportation.
Thank you, Jody. Thank you, Governor, for the opportunity. Thank you to everyone out in the community as well. Today is the first day of the Inter-Island Travel Quarantine Order, and the process has been very orderly. People are complying, and it does help that there are very few passengers, so a lot of people are listening to this order. The arrival numbers overall are now down more than 98.5% compared to this time last March. And it's anticipated to drop even more now that fewer inter-island passengers are going to be flying as well. Now, all inter-island travelers will fill out a declaration form. They will submit the form before going through the TSA checkpoint, meaning before they depart. Now, that is different from how it is done with the domestic and international arriving passengers who submit it upon landing. Now, passengers can fill out the declaration form. This is actually a copy of it that I got from the airport just from before coming here. But they can fill out the form in advance and prior to going to the airport. A copy of this form was sent out by the governor's office yesterday, and people can also find it on the HDOT coronavirus webpage. If people Google HDOT coronavirus, it is the first link or hit that comes up. So they can fill out that form. It is fillable. They can type it out and print it out from home and bring it with them before coming to the airport. Now, essential workers, while traveling through the airport and on the flight, can wear a mask, but it is not required on the flight itself. Now, essential workers, while on another island for that work, need to quarantine themselves when not working or providing that essential function. When they do get home, back to their home island, they will not need to quarantine themselves. Now, exemption inquiries and requests should be emailed to covidexemption@hawaii.gov. There's a team from the Attorney General's office that is diligently working on the responses, and they and we thank you in advance for your patience while you're waiting for a response. Now, passengers who are traveling for medical reasons, for treatment, or to see a specialist should also wear a mask and practice social distancing. If a patient does not have a mask, they can use a homemade mask. But even if they don't have a mask or can't make a homemade mask on their own, these patients will not be denied onto their flight. They still will be able to travel and go to their appointment. Anyone else who is traveling is subject to the mandatory 14-day self-quarantine and must stay at their home or place of lodging for 14 days or for the duration of their trip, whichever is shorter. Now, they are not allowed to go shopping or make any stops during that time. People should not be traveling at this time unless it is essential. Now, we do ask everybody out in to please help their community to stay home and do not travel unless it has been deemed essential. Thank you very much.
All right, thank you so much, Tim Sakahara. Our next and final speaker is Bruce Anderson, Director of the Department of Health.
Aloha. Yesterday, the governor and I mentioned the first death associated with COVID-19 under investigation by the Department of Health and expressed our condolences to the family. After completing the review today, it has been determined that the death was consistent with and was likely caused by coronavirus. Additionally, the person had recently traveled to Las Vegas, where we know the virus to be widespread and very likely was exposed there. We are sending a specimen to our state lab for repeat testing, but we expect the results to remain positive. Today's case count includes 34 new positive test results. One of the cases is a minor, and 33 are adults. 26 are residents, 1 is a visitor, and 7 are unknown, pending investigation. The fact that we have as many residents we do and so few visitors reflects the effectiveness of the mandatory quarantine program that's been imposed. We're seeing far fewer visitors, including returning residents, coming back to Hawaii at this point in time. 25 of the cases were diagnosed on Oahu, 3 on the Big Island, 1 on Maui, and 5 are still pending investigation. We don't know what county they're in at this point, but we will. So since the end of February, we've had a total of 69 cases that have been released from isolation. We added 11 to that list yesterday. Those were individuals who were released. And altogether, we have 258 presumptive or confirmed cases of COVID-19 to date in the state, with the vast majority being Hawaii residents. 194 of those are residents and 20 visitors. The department is continuing to investigate aggressively all cases and reported tracings of contacts. Most of these are now being reported through private clinical laboratories. And to date, there have been over 10,000 laboratory tests conducted by the private labs for COVID-19 testing from Hawaii. That makes Hawaii one of the top 3 states in the country for COVID-19 laboratory testing. The only states that have done more on a per capita basis are New York and Washington State, which of course are having a major outbreak at this point in time. I wanted to make one other short announcement. Today, a new facility was stood up in Ka'ahi, or on Ka'ahi Street in Iwalei. This is a quarantine and isolation facility for the homeless who have been found to be symptomatic and tested for COVID-19. Either they're waiting test results or they are found to be positive and are in isolation for that purpose. It's not a shelter for the homeless. In fact, it's being used only to serve as a quarantine and isolation facility for those homeless that are impacted. This facility was supported by all the major hospitals, as well as, of course, the city and county, Honolulu, and others. But it's filling a large gap that we've had in dealing with the homeless, and I think is a great step forward. And that completes my report. Thank you.
Thank you very much, Dr. Anderson. Time for our question and answer period. Our first question comes from Tim Hurley, Star Advertiser, and is directed to Governor Ige. Tim asks, why haven't any state workers been furloughed to save money and or reassigned to meet other needs?
We've actually reassigned a number of individuals. As you know, many of them have been reassigned for unemployment assurance so that we can respond. So we do have a program where we are looking at taking those who are staying at home because we are implementing social distancing and then implementing an aggressive work at home program for those who can work at home.
Okay, Governor, another question for you. This one comes from Daryl Huff, Hawaii News Now. Is the state getting closer to calling for a stricter shutdown, similar to what is being done in San Francisco, where non-essential construction is banned, fewer stores allowed open, and social distancing is mandatory?
You know, we are having daily conversations with the mayors in every county and the Hawaii Emergency Management Agency, looking at the effectiveness of our stay-at-home orders and all of the programs that we've implemented to implement social distancing. There is no other community in the country who have, as a whole, implemented more stricter guidelines than the state of Hawaii. We continue to evaluate the effectiveness of every program, and we continue to speak and talk and look at further action as required to keep our community safe.
Okay, Governor, another question from Eleni Gill, Civil Beat. When will the state's phased plan for responding to the virus be complete?
You know, we continue to look at the numbers of test results every day and evaluate whether stricter actions are required. We are looking at and focused through the end of April 30th. Most of the stay-at-home orders and the quarantine, mandatory quarantines are targeted to end at April 30th. You know, we will evaluate, and we do evaluate each and every day about whether it should be appropriate for us to extend those orders, or we are also looking at other orders that we believe is necessary to stop the spread of COVID-19.
Okay, one more question, Governor, from Manolo Morales, KHON2. Can you offer details on the text alert system suggested by the Senate committee? Or how soon would it start?
You know, the text alert committees are utilized by our county emergency responders, and we did have that discussion today. The counties are evaluating whether they will be incorporating additional messages in their text alert systems. I know that Mayor Caldwell and the other mayors are looking to that. We don't have a statewide text alert system, and certainly we would be looking at implementing such a system in the future.
Okay, thank you very much, Governor. Our next question is for Dr. Anderson. This is from Ashley Mizuo at HPR. Ashley asks, how many Hawaii tests are pending at private labs on an average daily basis, and are those who are severely ill, elderly, or have pre-existing conditions still being prioritized?
I don't have an exact number of tests which are pending, but the turnaround time now from the private labs is usually less than a day, so it's unlikely that we're seeing a significant number that are backlogged. For a period of time, the tests were being sent to mainland labs. For example, the individual who passed away recently had their tests sent to Texas for analysis, and it takes some time to get those results back. In fact, they were backlogged because of the backlog at laboratories across the country for as much as 10 days. So we're past that point at this point in time, and I haven't heard of any significant delays in getting reports back as of the last few days, at least.
Okay. Director, this comes from Rick Kwan over at KITV4. The 34 new cases today is the largest one-day increase. What do the numbers tell you? Is there reason for concern?
We fully expected we'd see an uptick in the number of cases. What we're seeing now is a shift from cases which are imported, basically travelers or people who are in contact with travelers, to cases where we have no travel history. And they do reflect that there is some limited local transmission. We expect this to happen, and we are doing our best to try to identify cases and contacts to tamp this down and keep it under control, and hopefully we'll be able to do so. Everyone that has followed this has noted that the number of cases will increase probably for a matter of weeks. And what we'd be looking for ultimately is a period of time where we see a decrease in the number of cases over, say, 14 days or more, and then perhaps consider relaxing some of the controls. But until then, all the mitigation measures that have put in place are extremely important. We have an opportunity in Hawaii that no other state has. We're an island state. We can shut off our borders, and the governor has essentially done that. Not only are shut off our borders and kept the disease from coming to us, but also, of course, restricted travel within our state so as not to spread the disease any more than necessary. So I think we're in really good shape to try to keep that case numbers down as much as we can.
Okay, while you're up there, Dr. Anderson, excuse me, this is from Tim Hurley. Have you projected when Hawaii's outbreak will be at its peak?
We're looking at a number of models that range from everywhere from a few weeks to a few months. It's almost impossible to predict at this point in time. We do have a new tool that's available to anyone who's interested. We've started to create the epidemic curve. We talk about lowering the curve, and in fact we're able now to look at what the curve is starting to look like. We're still early on in our course of the epidemic here in Hawaii, and I expect it's going to get worse before it gets better. But we can now track that much better. I might also add that we do now have maps available to the general public showing the distribution of the places where we're seeing individuals who have illness reside. It's a map that simply shows the zip codes where they live. That's probably not where they are exposed or where the disease is being transmitted, but it gives you a sense of how widely distributed these cases are. Again, most of the cases we've seen, most of the cases on the map are from people who've traveled back to Hawaii, brought the virus with them, and we want to try to keep it that way.
Okay, another question for you, Dr. Anderson, from Colleen Uechi, Maui News. With one death out of 258 cases, it seems Hawaii's mortality rate is much lower than other places. Are we projected to continue having lower mortality rates than the rest of the country, and if so, why is that?
First of all, we have an excellent healthcare system in Hawaii, probably the best physicians and hospitals anywhere in the world. So our residents here are getting the best care that could be expected anywhere, and that's helped to keep the numbers down, I believe. Normally, we'd see 2 or 3 cases per 100, and if you do the math, it's pretty easy to calculate. That would be 5 or 6 cases, deaths, that is, associated with this disease. So I think it's largely attributed to the quality of our healthcare system, the fact that the disease is being recognized now, and people know what to look for, and it's being treated appropriately at an early stage. We still can expect more deaths. There's no question. We have a generally older population in Hawaii, and of course the older individuals are generally at more risk. But having said that, I think we've done very well so far to keep the count down to where it is. That will likely change as well, though.
Okay. Dr. Anderson, one more question for you from Daryl Huff, HNN. Did new cases reported today reveal any clusters of infection? Have any cases been found by your contact follow-up?
We're continuing to look at contacts. Even some of the cases today were associated with travelers who came back from places which are a problem, or were cases where someone had come into contact with a traveler, a second generation, if you will. So we are continuing to aggressively look at every case. What's concerning, of course, is that we have seen a handful of cases, at least, where we have no travel history and no clear exposure to travelers, which again suggests that the disease is being locally transmitted here, but to a very limited extent. I would be very comfortable in saying we're still not seeing widespread transmission here in Hawaii, and we need to keep it that way. That's the reason for the social distancing. That's the only thing that's going to make a difference in the outcome of this disease in Hawaii.
All right. Thank you very much, Director. Our next question goes to Tim Sakahara. This is from Tim Hurley, Star Advertiser. How was the start of the inter-island quarantine, and how did you feel with the protective attire requirements? Anyone turned away?
So being the first day, it has gone very orderly. People have been listening and complying with the new order. It has helped, too, that the passenger numbers have been very, very low as well. So it's not causing a delay or any sort of backlog, especially with the inter-island having to do the screening and fill out the form before going through the TSA checkpoint. So from that sense, it has been fine. Regard to the PPE question, the PPE mandate is more related to those essential workers who are providing their essential function once they get to their workplace. It is not required for the flights themselves. So no one has been or will be, at least at this point, be turned away for not wearing proper PPE on the flight itself.
Okay. Also, Tim, this is from Daryl Huff, HNN. Are you allowing mainland workers to come to Hawaii to work on state projects, and under what quarantine restrictions?
Well, I did get Daryl's email on that earlier today. I am looking into it, but any sort of passenger arrival from domestic or international would all have to follow the the orders and mandates that are in place, unless, of course, it has been deemed official or essential. But even at that, even when the worker is not doing their essential duties or functions, when they do go back to their place of lodging for the night per se, they are not, they do need to abide by the quarantine rules. That's if, in fact, that is even happening at this point with mainland workers.
Okay. Okay, thank you very much. Tim, our next question is for Director Levens. Director Levens, can you hear us? This is from Eleni at Civil Beat. How can tenants find out if
Yes, I can.
Okay. How can tenants find out if their landlord's mortgage fits the CARES Act criteria prohibiting evictions?
Well, that's a very good question because there are websites that have been set up for the landlord to find out whether their mortgage is backed by the Fed. The tenant should ask the landlord about that. And absent that, it's actually quite difficult. I have one on the website myself, but the website that they've created is designed for the homeowner to input the information, not for a tenant. So absent something else that is going to be pushed out by the federal government, the best thing for a tenant to do is to ask their landlord whether their unit is subject to this federal jurisdiction.
Okay, thank you very much, Dr. Levens. Our next question for a governor. This is from Rick Kwan, KITV. Why are private construction projects considered essential work? And have you been notified of any projects not following proper COVID-19 precautions?
I do know that many of the projects are implementing social new construction practices to comply with social distancing requirements. You know, we haven't surveyed all of them. So certainly if there are members of the public see projects that they believe are not compliant, they certainly should let us know, and we certainly will look at that.
Okay, another question for you, Governor, from Ashley Mizuo. Can we expect any more incentives to attract and retain doctors here, like lowering or eliminating the GET tax on physicians who care for Medicaid, Medicare patients?
You know, I do believe that we will have to look at the physicians in our community for this COVID-19 pandemic. We have issued in my emergency proclamations the ability for those physicians and healthcare providers who are licensed to practice in other states to be able to provide services in our community. That was in anticipation that if we are not successful at flattening the curve and there are more cases than we can handle in our facilities or too many for our physicians and healthcare workers, then we will be prepared to allow assistance from out of state. You know, any of those other measures I think are long-term measures, which we certainly would be looking at in terms of attracting physicians and healthcare workers to our community on a going forward basis. But our immediate need is someone who can come into the community right away.
Governor, one more question. This is from Daryl Huff. Will you forward to President Trump the mayor's letter asking to ban travel to the islands?
You know, certainly we'll look at the mayor's letter and consider forwarding that to the president. We know that we've had many conversations with federal partners about closing airports and understanding what the federal requirements would be. Certainly, I did not have a chance to review the mayor's letter, but we would be looking at that soon.
Okay, another question for you, Governor, from Colleen Uechi with Maui News. Some companies here on Maui are getting a grant to build ventilators. Are there plans on the state level to fund the production of ventilators and PPE like N95 masks, gowns, and face shields?
You know, we are looking and working with our business community to see what capability exists in our community that can be modified to produce personal protective equipment and other things like hand sanitizers that we really need in our community. We have been working to assist those businesses in getting regulatory waivers from the federal government if necessary. And certainly if there are other companies that have the capacity to manufacture ventilators, we want to know about them, who they are. Please send an email to COVID Kokua or other ways that you can inform us of your capability, and we look forward to working with you. We definitely can anticipate a need for additional personal protective equipment, and the more we can be self-reliant, I think the better our community can deal with COVID-19.
And Governor, while you're there, Manolo Morales asking, do you plan to stop the release of inmates from jails or prisons?
You know, I definitely have a concern with the release of prisoners from our jails and prisons. I do believe that every single release should be evaluated on a case-by-case basis. I agree that prosecutors, the Attorney General, and the courts should look at the individuals involved and make a determination about whether they would be safe for us to release them in our community. You know, I think it's a balancing act, but just remember the concern that we have for our correctional facilities and jails are the introduction of the COVID-19 virus into those communities. We have taken action to shut down all of the obvious entry points. We've shut down visitations. We are doing screening for anyone who needs to come into a correctional facility. We've already released pre-trial detainees with very low bail amounts, and those that are looking for nonviolent or were arrested for nonviolent offensive. So I do think that those actions make sense. I do think that releasing criminals should be evaluated on a case-by-case basis in order to assure the safety of our communities.
Okay, and one last one from Daryl Huff from H&N. How far behind is the unemployment compensation system in taking in claims, and how long will it be until recently unemployed will receive money?
You know, we are working very hard to fortify our unemployment insurance benefit system. We've identified and added additional workers to help with the processing of claims, and we have reached out to employers and provided them the forms so that they can stay connected to their employees and help them get registered in our unemployment system. You know, we understand how important it is to get those checks out to those who have been recently unemployed, and we are committed to having that happen as quickly as we can.
Okay, thank you so much, Governor Ige. Our next questions are for Tim Sakahara. A bunch of them, Tim. Are helicopter flights, this is from Eleni Gill, Civil Beat, are helicopter flights still happening, or are they unauthorized?
So the helicopter flights would not fall under the inter-island mandate that began yesterday because they're not going from island to island per se. That being said, though, we will be looking into that. DOT will be looking into that to be working with the helicopter tour operators to pull back on the operations, as it is a situation, though, where the DOT itself would have to work with federal authorities because DOT manages the airports on the ground, but the airspace itself is under the jurisdiction of the FAA and the federal authorities. Right now, the airspace is open, and so we will work through those questions and work with the federal partners and the private companies themselves to determine what the outcome should be for the tour helicopters.
Okay, one more for you, Tim. This is from Tim Hurley, Star Advertiser. Could you provide clarity on the category called intended resident that's on the daily passenger arrivals updates? I noticed 359 have come to Oahu since March 26, with 114 of them just yesterday. Do you know where they're coming from, why they are coming, and what could have prompted yesterday's spike?
The intended resident category could fall under a lot of different people. In a lot of cases, they are military personnel who are being either stationed or coming to Hawaii for their work and their military duty, but they haven't started yet. So that is a large portion of the intended resident. Unfortunately, at this time, there are a lot of people that are getting laid off on the mainland, and they may have grown up here or lived here or have family here, but they're returning to the islands because they either lost their work or they could be students and their school has been canceled for the rest of the school year, and so they're returning to either live with family or come back to return as a resident here and maybe not go back to the mainland. But there's a lot of different categories that those people do fall under. I don't know exactly the reason for the increase in the past couple days, but the speculation is because there is a lot of job loss and a lot of unemployment. People may not be able to afford their rent or their expenses on the mainland, and so they could be returning home to live with family or to make that next step.
Okay, Tim, sorry. One more from Daryl Huff. How many non-commercial passenger aircraft have come to the state or traveled neighbor islands, and how are you tracking and enforcing quarantine on those travelers?
Well, I don't have the exact number of any charter flights or private flights at this point, at least not from domestic or international areas. I can say, just like everything else, the number of flights, incoming flights, has dropped dramatically and drastically. But anybody coming in on a chartered flight or private flight is also subject to the 14-day quarantine travel period. So they would have to stay at their place of lodging if they're not a resident, if they are a visitor, for the entire 14 days at least, or the length of their trip if it's shorter than that 14 days.
Okay, thank you very much. Tim? Governor, the next question is for you. This is from Ashley Mizuo, HPR. Is there any update on the emergency sites that HIEMA has been looking at, such as the Convention Center?
Certainly, I do believe that the Army Corps of Engineers have completed their assessment on a number of sites. I know that they are still making assessments to the neighbor islands. So the assessment goes in a couple of phases. You know, one is the initial assessment about whether it would be suitable for use as an alternative care site. And then they do go through and identify what specific work would be required in order to convert the facility to be used as an alternative care site. They do also do an estimate of what the cost might be. And then we are monitoring the utilization of every healthcare facility in the state. We have an inventory of the beds, and we get reports back from the facilities about utilization. We monitor ICU beds and use of ventilators because we know that that will be critical. At this point in time, the utilization have been below those areas that would require us to initiate alternative care sites. But we constantly are monitoring what the utilization is, and we would be looking at establishing these alternative care sites as we approach the capacity of any one of those critical items.
Okay, thank you very much, Governor. Our next question is for Dr. Anderson from Daryl at HNN. After a positive case in the airport postal facility, the Postal Service said there is no evidence virus can spread through mail and packages. Do you agree with that assessment? And are you satisfied with precautions now being taken there?
I think that assessment is accurate. There's no evidence that mail or other objects, similar objects, are effectively transmitting the disease. It is thought to be predominantly a disease transmitted from person to person through respiratory droplets or aerosols. in that respect, a face mask, even a homemade face mask, may help in spread of droplets and large particles. But as far as inanimate objects go, that's probably not a major risk factor. However, we do recommend washing your hands frequently if you're touching objects that are frequently handled. Of course, that's doorknobs and everything else that others may be touching. And it's always good practice if you're handling an object that you don't know where it's been or who's handled it to do so. So if in doubt, I'd say wash your hands. What you're worried about, of course, is not necessarily touching the object, but inadvertently touching your face after you've touched the object. I do that. Many other people do that without even thinking. It's really important not to touch your face at any time, but particularly after you've handled objects that you are unsure about.
Okay, another question for you, Dr. Anderson from Manola Morales, KHON. Have we started or planned to ask patients who've recovered to donate their plasma to help COVID patients?
That's actually being considered in a number of places. It's thought that once you've been infected with COVID-19, you develop antibodies, and it's possible that you could confer some resistance to others if you are able to transfer part of your the serum or other blood components, including platelets and things, to those who would be at risk. That hasn't been done yet in any wide scale studies, but it has promise for certain high-risk individuals, and certainly people are exploring that option. I don't know that's ever been done in Hawaii. I doubt it. But it certainly is one of the things that could be done under special conditions. We're all hoping a vaccine will be developed, and people will be able to develop immunity through a vaccine. But short of that, and anyone who's had the disease, in theory, would be resistant or incapable of being reinfected, and that's helpful to know.
Another question, this is from HNN. A story out of San Diego quotes a scientist saying surfers are at high risk for infection due to the virus being carried in the breeze and ocean spray. Do you agree? And should the state do more to enforce social distancing on the ocean?
I disagree with that. I think surfing by its very nature reinforces social distancing. I surf, and those I know who do surf keep their distance from others when they're out in the water. What I would be careful about, though, is people congregating on the beach, riding to the, getting to the beach together in the same vehicle, and otherwise gathering in groups. That certainly would be a potential risk factor. But actually getting out on the water is healthy and probably would actually be beneficial for those who enjoy it. It's certainly a good form of exercise.
Thank you very much, Dr. Anderson. Next question for Governor Ige. This is from Ashley Mizuo, HPR. Let's see, she asked earlier about the update on emergency sites. She's now asking at what point will these sites start being converted? What hospital occupancy rate is the state waiting for until these emergency sites are established?
You know, we are looking at that. We haven't had, we haven't set a specific threshold for every facility. You know, we are looking at each island and looking at the resources and assets that are available on the island in order to make decisions about activating and starting construction of alternative care facilities. You know, as I said, we monitor it on a daily basis, looking at utilization, and we don't have hard thresholds that I can talk to you about specifically, but certainly we are developing plans to do that.
Okay, another question for you, Governor, from HNN. What are the potential uses being discussed for Hawaii's vacant hotel space, for example, to house first responders and healthcare workers, nonviolent jail detainees, non-contagious hospital patients, or other groups?
You know, we are working with the hospitality industry to identify which hotels would be interested in being used for other purposes. You know, I have become aware that the hospitality industry had come together by themselves and wanted to offer to our healthcare workers and first responders the ability to stay in a hotel facility to reduce the traffic that the driving back and forth that may be required as part of their job, or if they would want to, in order to separate from their families and reduce the risk should they be exposed to COVID-19, to be able to stay apart from their family for a short period of time. So I'm excited about that opportunity. You know, we continue to look at hotels that could be converted into alternative care sites. We've talked with them about quarantine sites for a variety of individuals and other individuals that we need to separate from the general population. And so we evaluate those requests and those opportunities every day and make decisions about which ones make the most sense.
Governor, this is a follow-up to Ashley's question. Do you know how long it would take to establish the site after it's decided that one needs to be built or converted?
Certainly, the Army Corps of Engineers not only provide specific rearrangements or reconstruction that are required for every facility, but they also provide kind of a timeline and plan for when it would be required or how long it would be required to implement those programs. So we definitely are looking at what the lead time would be to convert a site and what additional work would be required for any of these options in order for us to anticipate any needs. You know, obviously, we have a wide range of options that we have. The tent facilities would be able to be constructed and erected in a few days. Modifying a hotel for alternative care to be used as a hospital obviously would take more time to do.
All right, thank you very much, Governor. Our next couple of questions go to Dr. Anderson. Dr. Anderson, Lenny Gill from Civil Beat asks, federal officials say that 100,000 to 200,000 people will die in the U.S. from COVID-19. What projection models is the state using, and what does the fatality rate look like here?
We're using the same main models that many other states are using in predicting what might happen. These are only models that are based on what have been observed in other locations. Obviously, we have a much smaller population than most other states, but there's no reason to think that our case fatality rate would be any higher than other places. In fact, it would probably be lower than most places given the excellent healthcare system we have in place today. We don't want it to be overwhelmed, and where you start seeing the very high case fatality rates, it's usually in countries and other areas where their healthcare system is marginal to begin with, and then immediately becomes overwhelmed when we have so many cases. So I would predict at least the case fatality rate would be lower than in most other places in the U.S. and certainly in the world.
Okay, one more question from Daryl at H&N. A construction worker in a downtown building tested positive earlier this week. Were you satisfied with the way the building responded to the positive test, especially in regards to protecting other workers?
I'm not familiar with exactly what happened in that situation. However, I believe that most of the businesses in town now are following our guidelines, and if an individual is a contact are of course recommending that individual be isolated or quarantined. Almost immediately, if there is a case, we will follow up with all the workers who might have been might be close contacts with that individual, and of course we would also independently advise them on what precautions should be taken.
Okay, thank you very much, Dr. Anderson. We have one more question, and it's a numbers question. From Manolo Morales to Tim Sakahara. He's just asking how many people flew inter-island so far since the midnight start of quarantine. Do you have that number? He's looking, Manolo.
I do not have the exact number of inter-island passengers as of yet. The thing about inter-island, too, that you don't want to double count them per se, because some people might be flying inter-island to get from a neighbor island to Honolulu per se, and then from Honolulu going to their final destination on the mainland or wherever it may be. So I don't have the numbers quite yet, but I can say that I was at the airport again, all morning, and it is like I've never seen it before here or at any major airport. I mean, there are so few people at the airport. I mean, it's sad in a lot of ways because it's going to hurt for a long time for the people in the transportation industry. But it's also positive in the fact that it shows that people are taking this to heart. They are not traveling, especially when it's not necessary, and they are doing their part to prevent the community spread by staying home. But in general, I do not have the inter-island numbers yet.
Thank you very much, Tim.
Thanks.
Governor, some closing remarks?
Once again, I just really wanted to thank the people of Hawaii for really coming together as a community. We have seen that the stay-at-home orders, the quarantines for incoming travelers, the quarantines for inter-island travelers have been effective in reducing the people traveling around. We want to remind everyone that we can only be successful if we all take responsibility to separate ourselves, to stop social gatherings, to be focused on helping one another. We want to remind you, if you're sick, you should self-isolate and stay away from others. And I am just so encouraged by our community recognizing that there are some in our community that need help and have been more than willing to step forward. I do know that we as a community will come together and defeat this COVID-19 pandemic. Thank you very much.